Aloha guys, it's Dr. Tom coming back at you again, yes. We're coming live from the island of Oahu, and it was live when I recorded it. Okay, we're talking about Unit 18, Vitamins, Minerals, and Herbals, one of my favorite topics. This is interesting. 4 out of 10 leading causes of death directly related to poor diet. Poor eating habits begin in childhood. Diabetes has risen to an epidemic level. Yes, it has, guys. To be obese, of course, you can be overweight, but to be obese, you have to have a body mass index greater than 30. And there's different ways to calculate that. I don't put a lot of stock in it, but however, guys, I do think that this is real important. My personal opinion, I was born into an obese family. I've had a weight problem my whole life. All of us have in the family. And what I've found is that the average person eats probably twice as much as what they need to be healthy. And that will kill you over the long run for different reasons. Get into them later. Dietary guidelines, let's see, eat a variety of vegetables and proteins, control calorie intake. This is a big one in my opinion. And also watch out for those carbs, guys. Increase fruits, vegetables, and whole grains. Reduce saturated fat and cholesterol. Use low-fat or non-fat dairy products. Limit sugar and salt, definitely. Consume less than 10% of calories a day from sugar and saturated fats. Yeah. The sugar and carbohydrate, of course, sugar is a carbohydrate. Guys, after been in natural health for almost 40 years, that's what's doing us in. Okay. USDA new food icon, that's the United States Department of Agriculture, emphasizes fruits, vegetables, grains, protein foods, dairy groups. Make half your plate fruits and vegetables. Make half your grains whole grains. Yeah, why not go ahead and make them all? Because it's not quite, it's like eating brown rice and white rice, guys. The brown rice just is more healthy, but it's just not as tasty. You know? Okay, very protein routine, eat and drink the right amount. Yeah. Again, my personal opinion is we eat 2 to maybe 3 times more. And of course, a big obese person might eat 4 or 5 times as much as what they need. The 5 basic food groups: grains, 3 or more ounce equivalent a day. Fruits, any fruit or 100% fruit juice. That's true, guys. You got to watch this. Why? It's loaded with sugar. Now, I know what you're thinking, but Dr. Tom, it's the natural sugar in fruit, which is fructose. Yeah, but it's still sugar. Especially fruit juice is loaded with it, man. I don't think that fruit juice is healthy for you. Maybe a little. I mean, it's better than a Coke, but vegetables, sufficient amount while staying within energy needs. It's hard to overload on vegetables, guys. You can, but dairy, 3 cups of fat-free or low-fat milk or equivalent milk product. Protein, 2 to 3 servings a day. I lean towards high protein, high fat, and low carb myself. And there's a lot of people, which is more or less the keto type diet. There's a lot of people would agree with that. Okay, vitamins. There are fat-soluble vitamins and there are water-soluble vitamins. The easiest way to remember it is to memorize the 4 fat-soluble vitamins, which are A, D, E, and K. They can be stored in adipose tissue and in the liver. So these are all very important. Vitamin K actually is made in the small intestine from bacterial action. You have to be very careful. Well, not very careful, but careful that you don't eat too much of it because it can get stored. However, guys, you have to eat a lot. Water soluble are all the rest, like vitamin C and the B vitamins make up a huge group. They're not stored in the body because they're water soluble and they have to be replaced daily. So eating good whole foods and all, you will do so. Minerals, body weight is 60-70% water. Homeostasis, we know what that is. Normal fluid state in which positive and negative ions are in balance. Among other things, yeah. Electrolytes, sodium, potassium, calcium, magnesium, chloride, carbonate, phosphorus, sulfate. This is what, guys, makes nerves function and all kinds of things. Makes fluid levels proper and all that. But without sodium and potassium, that's what makes nerve impulses, action potentials. Herbal and supplements. DSHEA is the Dietary Supplement Health and Education Act by the FDA, 1994. Of course, you can get them over the counter. You don't have to have a prescription for them. Not tested by FDA for safety and effectiveness. More natural way of treating disease. Always tell your healthcare provider about any herbs or supplements you're taking. Yeah, they may not approve, and there's a chance they won't, but yes, some of this stuff can interfere with prescription meds that you're on. Otherwise, I wouldn't necessarily tell them because they don't know. I'm going to say something, guys, that might be mildly shocking to you. The average person in a health food store knows more about this kind of stuff than a doctor does. Why? They don't have any training or very little. In my day, a medical doctor had no training in nutrition other than the basics in biochemistry. So they don't know unless they've taken an interest and learned on their own, and they come from a different philosophy and background. So, may interact, well, here it says certain medications. However, now most of them nowadays I think are more open to taking supplements. But I mean, for my entire career in the health field, the AMA, the American Medical Association, these other people have said that taking vitamins and minerals is harmful and a waste of time. And nothing could be further from the truth. They are absolutely freaking wrong there. Okay, well, that takes care of that. Effects of medication on body systems, Unit 2021. Guess we don't have any for that. Okay, musculoskeletal system. We all know that. Composed of bones, muscles, ligaments. 206 bones in the body, more than 650 muscles. The muscle chain varies just a little bit, some of the small ones. Okay, anti-inflammatory drugs. Inflammation is a normal response to injury, infection, or irritation of living tissue. Yes, it is. But as I've often said, it sometimes goes too far. And when it does, it has to be controlled, or it actually can delay healing. Symptoms: redness, pain, swelling. Causes breaks in the skin, contact with caustic substances, rheumatic diseases, injuries. Most provide symptomatic relief, but do not treat the cause. But if you can get the inflammation under control, guys, it helps a lot. Okay, glucocorticoids or corticosteroids. We all know about athletes using steroids, like if they have an injured knee or shoulder, elbow, and trainers injecting steroids in there. Steroids are synthesized, I think, from the natural steroids produced by the adrenal glands. And they're very, very effective at reducing inflammation, which reduces the symptoms. But they also can be quite dangerous too. Used for multiple inflammatory conditions, several body systems. They modify the body's immune response. They weaken the immune. Remember, fight or flight? And for this reason, they can cause problems if they're used for long term. May be given orally, applied topically by intramuscular injection, or by an intra-articular injection. Contraindications: people who have known hypersensitivity to them. Systemic fungal infections. Why? It suppresses the immune system. Fungal infections can become worse. Idiopathic thrombocytopenia purpura. This is where you're making too many red blood cells. Acute glomerulonephritis, kidney problem. Amoebiasis, amoebic dysentery, the amoeba, single-cell organisms. You know it because you have wild diarrhea. Non-asthmatic bronchial disease. Children younger than 2. Yeah, Now, I am a fan. Well, I guess I'm not necessarily opposed to glucocorticoids and steroids, but they have to be used carefully. One I like more, but it's not as powerful, is our NSAIDs, non-steroidal anti-inflammatory drugs. Synthetic products work by inhibiting prostaglandin synthesis, commonly called gastrointestinal distress. So it's important to take like ibuprofen and that with after you've eaten, so you've got something on your stomach. It can cause bleeding in some cases. May potentiate anticoagulant effect of warfarin. That could be a problem. Warfarin's a blood thinner a lot of people are on. May affect blood glucose levels. Yeah, it can. That's another thing that the steroids do. Pump it up. The NSAIDs, I wish they had that word here because that's what they're called. Tylenol, and I believe Tylenol is an NSAID. I know that ibuprofen, Motrin, and that is. They're good as long as if you have a history of ulcers or something, you can't take them. They can be very dangerous, but other than that, they help. Drugs, modifying anti-rheumatic drugs. That's also called SARDs, or second-line drugs. This is for the treatment of rheumatoid arthritis. Let me just say very briefly, rheumatoid arthritis is an autoimmune disease. It's very serious. It's very hard to treat. It is not common. Osteoarthritis is the regular kind that everybody knows about. But fortunately, it's not common, but the sad part is it's hard. They even give them gold injections and stuff. It's very hard because it can cause horrific damage to the joints. And again, you can treat it by giving drugs that suppress the immune system, but then you open up a can of worms for all kinds of other diseases and cancers and things. COX-2 inhibitors. Let's see. Is enzyme involved in an aspect of normal cellular function, inflammatory response? So this COX-1 and COX-2 are a common part of the inflammatory response, and these inhibitors go in there and inactivate them, inhibit them some. Celebrex is well known. I've read some bad things about it, but it depends, guys, on how badly you're hurting and all too. Anti-tumor necrosis factor drugs, biologics. That's the response modifier, slow halt destruction of joints, disrupts activity of tumor necrosis factor, preempts autoimmune responses. That's good. Humira. Humira is the only one of these I've heard of. Increased risks of systemic fungal infections. Why? Suppresses the immune system, guys. Fungal infections can be real serious. They get deep into those tissues and they're very hard to treat. Now, this again would be for some real serious arthritis. Okay, osteoporosis, loss of bone salts, bone minerals, and the ground substance that contains them. If you have a T-score less than 2.5, they can measure it by your foot and all. A lot of postmenopausal women, guys, have a lot of them have problems with osteoporosis, but older men can too. Leads to increased risk of fracture, yeah, because they're thin and brittle. Most common in women after menopause, yes. Treated with anti-resorptive medications to slow bone loss. That was bisphosphonates, calcitonin. Calcitonin is what is secreted by the thyroid. THT, estrogen agonists, antagonists. Why estrogen, guys? Because bone mineralization is linked to estrogen. And after menopause, estrogen levels fall and mineralization of bones diminishes. Gout. Gout is where these little tiny crystals get deposited in the joints. When I was in school, I saw microscopic slides of these things, and they are wicked looking. They look like little razor blades. The most common place to get gout is in your big toes, and it's so painful you can't stand the weight of a bed sheet on it. It's caused by hereditary metabolic form arthritis. Also, it's from uric acid. I couldn't think a moment ago. It's also found more in men and in people guys that eat a lot of red meat. These big old drink and booze it up and pack away big steaks and all. Caused by excessive uric acid in the blood, hyperuricemia, and deposits of urates of sodium in joints. There are drugs that can help it, and I think if you change the diet, often it'll help some. Again, it's hereditary, so but so many things, guys, are linked to diet and lifestyle, and gout is too to some extent. You got to change your diet. Hey, I'm sorry if you want to eat a 20-ounce steak 3 times a day, but you can't do it. You have to switch to pork. No, be reasonable about it, because these people suffer, man. These uric acid crystals are wicked looking. Muscle relaxants, used for muscle spasms resulting from strains, sprains, trauma, or disease. Central acting muscle relaxant depress the CNS, causing drowsiness, dizziness, and blurred vision. Scalaxin, Flexeril has once been around a long time. Guys, I worked in family medicine 5 years in Florida. I ran the therapy department for them. A lot of the patients I had were taking pain pills and muscle relaxants that were given to them by my boss, the doctor. And everybody across the board, all those years and since, has said one thing about muscle relaxants. Well, they help you sleep, but they don't really relax the muscles. That's all I've ever heard, and I've heard it many, many times. So they don't actually relax the muscles, guys. Although, if they help you sleep, that's worth something. If you're hurting and can't sleep, and muscle relaxants will help you get a normal sleep, then it's worth something right there. But no, they don't. They very minimal relaxation of muscle. Unit 22, gastrointestinal upset. We got 30 more seconds, so we got to stop. Common complaints are ulcers, GERD, gastroesophageal reflux disease, dyspepsia, pyrosis, nausea, vomiting, diarrhea, and constipation. Causes of GI complaints. Look what the first one is. Poor diet. You eat a bunch of spicy, greasy crap, guys, and you're going to have a tendency to, it's going to come back up into the esophagus and irritate it. All right, Dr. Tom's going to sign off. I'll be back shortly.